Hi guys, how are you doing? It's Elaine Bintz, certified health coach and personal trainer. It's Friday, January 17th. The weekend is here. I hope everybody's having a great week. And if your week is not going that great, I hope your weekend is better. So the topic for today is all about physical therapy. So I am not a physical therapist. I am only a bachelor's level education. I did go to graduate school for some things for continuing education, but I did not study a course in graduate school. I do not have a master's. I do not have a doctorate. So what I do is I refer people to physical therapists when their needs exceed what I can help them with. So one of the physical therapists I really like, she actually practices at the Body Tech, same place in Illinois where I practice. Her name is Valerie Williams, and here is her card. Valerie Williams, her business is called Body and Sync. You can always check out the Body Tech website in Mokina and look up her info. There's a ton of different physical therapists you can go to. There's specialists for physical therapy with women's health. You can go to people who specialize in orthopedic issues. You can get free screenings at a lot of these physical therapy places. Pretty much just call if you are having a problem. And we talked a little bit about this in the other video about MAT and NKT. Maybe you can't find one of those specialists. And a lot of times the people who practice MAT and NKT, they don't accept insurance. Like I don't accept insurance. I'm a cash-based business. So if I have somebody who seeks me out and they like my credentials and they want to work with me, but they're in a lot of pain or for whatever reason they cannot exercise, I recommend that they check out physical therapy and then see if their insurance is going to cover it. So a lot of insurances will cover physical therapy. And if you can find a location that's close to where you physically live, you could make it so that it fits into your schedule. And a lot of them have really flexible hours, so it's great that a lot of times it can fit into your everyday schedule. But physical therapy. So most people have gone to physical therapy and then they get discharged from physical therapy and then they never do their exercises again. That's a problem. Okay, so you want to continue doing the movements you did in physical therapy. So let's say, for example, I have a client, person, friend, loved one, they have back issues. So say, for example, they didn't want to do surgery, they didn't want to do, any sort of a chemical, whether it was an injection or a pill or something that would potentially lead to more damage down the road. Maybe they, the doctor recommended they do some sort of a fusion and they wanted to try physical therapy, they wanted to go the natural route. The thing is, when you finish physical therapy, the idea is that you continue doing the movements you were doing in physical therapy that made you feel better. So I know that like a lot of my physical therapy friends, a lot of them went to undergrad with me and then they continued their education. That's one of the things I hear oftentimes from the professionals in the physical therapy world is if the patients continue to do the physical movements, it would bridge the gap between them returning to physical therapy unless there was some sort of an accident or an acute injury. So I cannot emphasize enough the importance of continuing to do your physical therapy. Oftentimes you can buy bands, something at home you could use and you could do the movements. A lot of times they only take maybe 10 or 15 minutes. And if you do go to a gym, you could do your physical therapy exercises at the gym. Maybe make that after your warm-up. Maybe it's your first 10-15 minutes of your workout. Maybe your physical therapy is your workout and you just keep doing that for the rest of your life. The goal is just to be pain-free and hopefully you feel better every day. So physical therapy can be a workout. So depending on how you feel. Everyone I've talked to that has had a knee replacement, I've had so many different stories about how the person feels, and depending on how much their pain tolerance is, some of them are not feeling the best in physical therapy, but they're getting results and it's more functional. They're having more ability by allowing the therapist to push them just a little bit, those little increments beyond their comfort zone. But of course, like I said, I am not a physical therapist. I fully support physical therapy. If you weren't interested in working with me and you are getting discharged and you're getting to the end of your physical therapy, I ask for written permission, of course, if I I can see the physical therapy exercises they give you, because that's called post-rehabilitation. A personal trainer can start you with the physical therapy exercises and then graduate you onto more challenging exercises in your exercise program. All right, so thank you guys for listening. It's Friday. I hope everybody has a great weekend, and I'll see you tomorrow. Have a great day. Bye.